Hi there, I'm Charles Ellison. I'm your moderator for this morning. Welcome to another Micro Summit. We are doing a Micro Summit here on the COVID-19 pandemic and equity gaps during that pandemic. These Micro Summits are being produced as part of a partnership between Healthcare Ready and also the Council of State Governments Eastern Regional Conference, Council on Communities of Color. We've had a nice series, a nice in-depth, insightful series of discussions and micro summits on equity gaps that are affecting various populations, particularly vulnerable populations during this time of pandemic. We've also been having a lot of conversations recently about reopening as we are still in pandemic. Over 100,000 Americans have tragically died, but as we're in that pandemic, we're also now reopening states. Many cities and states are reopening. So what does that pandemic return policy look like? What laws, what guidelines, what policies do we shape as we navigate the reopening? We have our panelists here to discuss that and come up with some solutions, come up with some ideas on how we move forward. Let me go ahead and one of our panelists actually is a little bit late. He should be with us shortly. That's State Senator Kevin Parker. He is Vice Chair of the Council on Communities of Color for the Council of State Governments Eastern Regional Conference. He will arrive shortly, I'm sure. In the meantime, those of you who are in the audience, you will have an opportunity to ask questions. You will do that in your Zoom group chat on the lower right-hand corner of the screen. Once again, I'm Charles Ellison. I'm your moderator for this morning. Really do appreciate people's chiming in and participating with us this morning. For more information on Healthcare Ready, you can go to healthcareready.org. Also, Council of State Governments is at CSG Eastern Regional Conference, CSG-ERC.org as well. I want to thank them for making these continued micro summit conversations possible. Joining us on panel is Dara Lieberman. She's Director of Government Relations for Trust for America's Health. Also, hi there, how are you doing? Dr. Matthew Minson, who's Senior Advisor for Health Affairs at Texas A&M University Health Science Center. Also a former state, local, and federal health official. We also have joining us Brooks Nelson, Senior Director at the U.S. Chamber of Commerce Foundation, and David Newville, who is Prosperity Now's Vice President of Policy and Research. And I see we have State Senator Kevin Parker is joining us representing the 21st. How are you doing, sir? The 21st Senatorial District of the state of New York, also chair of the Telecommunications and Commerce Committee for the New York State Senate. So welcome all. Do appreciate your time today. Also, once again, a little bit later on in the half hour, we will give participants or audience members an opportunity to ask questions a little bit later on. Senator, I'm going to start with you. We're reopening full ahead in most states. New York obviously being a little bit more cautious than others, but just want to get your impressions on the types of guidelines and policies and regulations we should be leaning on as we're doing this reopening, what you're exploring, what a legislator like yourself is looking at doing, what that reopening should look like. Let's put State Senator Parker off mute.
That's me. I'm bad. Early morning. We had. I apologize. We had session until like 3 o'clock in the morning. So it's been a little busy. So first, thank you for including me. I'm glad to be a part of this conversation. Let me give a lot of credit to our governor for putting forward a set of guidelines that I think make sense. As you hear everybody else, they're kind of setting their guidelines on opening and reopening them based on dates, as opposed to based on benchmarks. And so I really agree with what the governor has put forward in his New York Forward plan as it looks at benchmarks. It looks at hospitalization rates, it looks at death rates, it looks like preparations for regions to have PPE stockpile for 90 days. They have to have a occupancy rate in their hospital beds and ICU beds in order to open. They have to have contact tracing and testing in place, sufficient, for the population. And so, I think that is a much more prudent course of action than just to set a date and arbitrarily, ready or not, we're opening up because we've reached a date. This virus does not look at calendars as far as I can tell. And so it may not respect the date that we put forward and saying, all right, your curve virus better be bent, and down, and, by the time that we set these dates. And so I think that we really have to follow the science. We have to look at the numbers, and we have to proceed cautiously and slowly as we look to get back to regular activities and particularly our economic opportunities.
Dara, I'm real curious. You're with Trust for America's Health, TFAH.org for more information on that. But Dara, real curious, I know there's been a lot of conversation about testing and the various modes of testing to determine who's infected and who's not. I haven't heard as much conversation about hospital capacity. I want to talk about that for a few moments. Basically, how many beds do hospitals have? Why aren't we having a bigger national conversation about that? And that's particularly important for those vulnerable populations as we're trying to figure out, like, okay, we have certain Black and brown populations or populations like where Senator Parker is in Brooklyn that are disproportionately impacted. So fine, on one hand, they're being tested, but then if they are seen as positive, okay, well, what about the next step? Are the hospitals ready to take on future surges?
Right, and I think, there are a lot of layers to that question. One is that we don't have a great picture of hospital bed availability in this country. I just saw an article this morning that ICU beds are starting to fill up again in some cities, and that could be in disparate ranges of cities, and that could be an indicator that we haven't done a good enough job of containing the outbreak in those places, or maybe have been overly aggressive in reopening places. But we do need a better national picture of bed availability, and that doesn't just mean beds, but it means staffed beds. And of course, the underlying issue there is that there are major health disparities in communities of color, especially in our nation, that are being exposed by this crisis, and that of course many of us knew was going to be an issue long before a pandemic hit. So we need to be making sure that we're targeting resources to making communities healthier before even the next pandemic hits. So really targeting and making sure that money is getting down to the communities of color, to the organizations that work in those communities and disproportionately impacted communities is going to be critical.
Dr. Minson, definitely weigh in here as far as if you want to follow up a little bit on what Dara was talking about as far as that hospital capacity. And as we're thinking about hospital capacity, along with reopening and then the fears of future surges, future infections, in your mind, what is that ideal policy or regulatory framework for handling all of that?
Well, I'll echo that that's a nuanced question. I think the thing that I come back to from a medical standpoint is that this is a novel virus. We still don't know what we don't know. We started off talking about the fact that you didn't need masks, and then we said you don't need to worry about children. Both of those turned out to be somewhat estimations were wrong. So in terms of hospital capacity, I think it's one thing to have stuff. It's another thing to have the ability to force multiply if necessary, and use people that don't traditionally do things like ventilator settings and operate certain types of equipment, be able to either use basic templates that allow them to expand the capability of, say, a critical care physician to do that job. I'm not sure we've actually done that yet. And so that's something that going forward, and especially looking at the fall and potential second waves, and if history shows anything, we may be looking at that. That is something that gives me a bit of pause right now.
Hey, Brooks, so we're talking about hospital capacity as cities and states reopen. People are very nervous about that, very nervous about what that might mean. People are trying, just individuals as they're slowly emerging from their households, they're trying to figure out, okay, well, how do I navigate this new landscape? How do I protect myself? And then we talk about workers going back to spaces, going back to workspaces, going back to also public spaces, whether those from grocery stores to even some office spaces as well. And then we have to consider the frontline workers. And so how do businesses, small, mid-sized to large, prepare for people coming back? What are the guidelines that, say, an organization like yours, the U.S. Chamber of Commerce, is giving them? What sorts of guidance do you want to receive from healthcare professionals on that?
Yeah, absolutely. Thank you for having me. We know there's a lot of information out there, and it's overwhelming, especially for our small businesses. So we have tried to synthesize it as much as possible on our website. So there's a number of resources and guides for businesses. But we gather the information, look to CDC and what AIHA is putting out and other guidances. But we know that every state is a little bit different. So you need to make your plan. Considering your budget, what the physical location is, your supply chain, and then execute it. But I think the keys there is really thinking about your employees and your customers. And our guidance is to over communicate. Share what your business is doing to make sure that you're making sure that the customers and employees know that their health and safety is your number one priority. And so as much as you're asking for their input, asking for that guidance, and then communicating those steps that you're taking, it can help provide that reassurance.
David, from your perspective, Prosperity Now, and then looking at what Brooks was saying, and also Dr. Minton is saying, and kind of blending that in Dara, that still concerned about that equity component, because particularly as we've been talking about frontline essential workers. A lot of those frontline essential workers are those Black and Latinx populations, and that's one of the reasons for those high infection rates. So how do we balance all that? Because people have to go back to work. Still, you got to keep the economy churning, but then how do you strike that balance? It seems like we're creating on the fly some sort of pandemic economy, if you will.
Yeah, absolutely. Prosperity Now, we're focused on the financial side and kind of the racial wealth equity side of the equation in the pandemic right now. And you're right. I mean, there's, even as we're opening up, it's slow, obviously, in most states. And there are workers who are on the front line, usually workers of color predominantly. And then, there are other workers who aren't coming back. And I think our emphasis has been on making sure, both at the federal and the state level, that those workers that are out on the front line are financially protected and have the supports they need. But also, we don't forget that, you can't pull all the supports that have been kind of bolstered out there by the federal government and state governments when it comes to either enhanced unemployment benefits, or even when you think about the rebate checks, the stimulus rebate checks that went out. Many people have received them, but a lot of folks have not. The Treasury, for folks who don't have a bank account or aren't connected, they could not receive their payments until August, potentially, if it comes by mail, by paper check. So I think remembering that it's going to take time that everyone is financially struggling, and that even workers who are on the front line right now working at grocery stores, we knew, we were at a historic peak in terms of the economy, at least when you look at the stock market and other measures. And, according to research that we've done, almost 37% of workers were what we call liquid asset poor, which means they didn't have enough in savings, liquid savings, to basically survive at the poverty level for 3 months. So a lot of these workers were fragile to begin with, and business owners too. As Brooks pointed out, the PPP program, the Paycheck Protection Program, making sure that enough of those funds actually still get to those small business owners and micro entrepreneurs in vulnerable communities, those of color who are leading these businesses, making sure that they're having access to the program still too. That is ongoing. And they're going to need that money in order to be able to get the personal protective equipment and to get themselves opened up, and they're going to have reduced openings in many cases. So I think, states need to be mindful, the federal government needs to lean in on a lot of this, but I think states also need to be mindful that it's going to be a long transition in, and we may, it may be back and forth, as was mentioned earlier. So you just have to be careful if the financial supports are there.
Yeah. Senator, how do you make these policies, this sort of reopening response policies or framework of reopening response policies practical enough that they aren't getting politicized, if that makes sense? Like we are finding a lot of politicization of the reopening, of how to go about it, of even simple things, practical things like wearing masks or wearing gloves, or what that's going to look like going back into public spaces. So how do we create that response framework that guards against that type of politics, noxious politics, that can also prevent people from just being able to properly navigate?
You can't. I mean, at the end of the day, politics is infused in everything that happens. And this country is over politicized right now, and I don't see a dynamic in which that changes.
Mm-hmm.
So the reality is, all you can do is give people the best information and hope people act on it, and act responsibly, and provide the kind of things that people need, both information and the physical things that people need: testing, tracing, access to masks, access to food, access to financial supports, and hope that people take advantage of it and use it the right way. But the reality is that I don't know how you create a political political. I don't even have a word for it, to be honest with you, Charles. I mean, to be honest with you, there's always going to be in politics and everything that we do, and people are going to respond to
do
it.
this without creating the political tension and hostility and animus that we're feeling.
Yeah, I mean, look, I think again a lot of that is built in because the relationships existed, BC, right, before COVID, right? And so while we're in DC during COVID, I don't see how in a few months those things are going to change, right? And so I get on, the first thing I do is start talking about how wonderful the governor is, but he has a very high approval rating, but it's not 100%. And there are people in the government, including Democrats, who are criticizing him for the way that he's operating. And so I think that the reality is that political decisions are always going to be fraught with political criticism. Yeah. And I think that you just have to just be okay with what's going to come, do what you believe is right, and keep moving forward. And frankly, it's part of what you're seeing in other states as well. But it's also understand that there is a racial undertext in terms of how people are operating. Let me say this to be clear: white communities have not experienced this virus the same. Everybody's not having the same experience with this virus, right? And in Black and Latinx communities, like the one I represent, where zip codes like 11203, 11226, where we've had 40% of the population come down with the virus, and when we're having thousands of people die literally in the shadow of the hospital. That is not the same dynamic that people are even in the state of New York are having upstate New York. And so upstate New York, they're like, what are we talking about? Why do we have everything closed? Open up, open up, open up. People in Brooklyn, even after they open up, I'm hearing people saying they're not coming back out their house to maybe August. Because people are terrified because we're experiencing this in a very different way, right? When we go on, I have people say that they stopped going on Facebook because they're tired of seeing the people dying, and they're tired of hearing about people being sick. They're like literally in the house, they're not watching the news, exactly because the inundation of what Black and Latinx communities are experiencing is very different from what the vast majority of white people are experiencing, again, upstate New York, or even the Upper East Side in Manhattan is having a very different experience with this. And so their political responses is going to be predicated on how they're experiencing this virus and this pandemic.
Yeah, I want to go, once again, welcome to our micro summit here. You were just listening to State Senator Kevin Parker. He is chair of the Council on Communities of Color for the Council of State Governments Eastern Regional Conference. Also joining us, Dara Lieberman. Dara, I want to get to you in a moment. Director of Government Relations for Trust for America's Health. Dr. Matthew Menson, Senior Advisor for Health Affairs at the Texas A&M University Health Science Center, Brooks Nelson is Senior Director at the U.S. Chamber of Commerce Foundation, and David Newville, Prosperity Now, is Vice President of Policy or Research. I want to get a little bit more granular here too with some of these proposed or potential policies and guidelines, what the regulatory schematics might look like, and some of the roles of certain folks in that and implementing that. Dara, you know, what do we not, let's start off at the top with that more granular conversation. When we're talking about returning with and what that regulatory schematic might look like for reopening, what are we missing in that conversation, you think, when you're listening to that national conversation or even the more localized statewide conversations that are taking place? What do you think we're missing in terms of those policies and guidelines?
Well, one of the things I wanted to mention is that a lot of times it looks like people are viewing public health and reopening the economy as in conflict, when really they need to go hand in hand. And we can, and as you mentioned, you know, reopening doesn't mean flipping a switch. Everyone goes back to how life was, as the senator said, BC before COVID, but slowly, you know, re-engaging in economic life, but with proper protections. But in order to do that, we need a strong public health response at the same time. And so that does mean much more expanded testing. It means effective contact tracing. And as David was saying, people need economic support. So when we do this contact tracing, it means you might get a call that says, let's say your whole office or your whole workplace has gone back to work, and you get a call that says you've come in contact with somebody who tested positive, you need to stay home for 2 weeks. But that's very hard for people to give up that paycheck if they don't have paid leave, for example. So states and the federal government need to provide much stronger paid leave protections. Dr. Frieden and a bipartisan group of public health experts have recommended economic supports for people in isolation so that they can have some, you know, a daily income, like a jury duty type payment plus food. And we need people to be able to safely stay home in order to contain those small outbreaks. So that will involve state and federal support.
Hey, Matthew, I'm real curious, like when I listen to these conversations about the reopening of public spaces, workspaces, I don't hear a lot about licensing and inspection, or like what can, you know, typically when you need a business or you need a public space or you need a grocery store, they need to comply with certain city-state regulations. Obviously, that's when you have your licensing inspectors come in and start to make sure that they're complying. We don't hear a lot about that. What sort of role should like a city and state L&I or regulatory inspection or licensing inspection agency play? I would think that their role would be rather muscular in a situation like this.
Well, I wish that they were. The truth is, when we start to talk about things like the extensions of those types of powers, those vary, and it's like saying government is one thing. It's not. It's three different things. It's local, it's state, and it's federal. Depending on whether or not it's a home rule city or whether or not you're talking about a cascade of powers from the state to a county, per se, for example. There's a little bit currently under an emergency declaration, which changes things substantially. For example, the tests that we're using are currently not approved tests. They are authorized to be used because they are the tool we have at hand, and we feel that the harm in not using them would be greater than the potential fail points that go along with those tests. That's a very important piece to remember here. You talked about regulatory agencies. I would say the thing I haven't heard in the discussion is OSHA. Especially in situations where you've got disparate populations, or you've got a group of people that actually have jobs that require them to go someplace. I think the senator mentioned the fact that we're seeing the differences in race and in certain demographic populations, because some folks can stay home and work, others cannot. They have to go because of the nature of their job. I don't see PPE provisions that potentially could be expanded a little bit under OSHA provisions. I don't see any discussion of the OSHA 3110 rule that has to do with things like long-term effect and records. So I see that there are some regulatory opportunities and probably some areas that need to be expanded a little, especially when we start to talk about these types of work environments. I hope that makes sense.
No, it does make sense. It's very useful too. Brooks, follow up on what Matthew was talking about there, and two, I'm wondering if going back to the experiences of and also the preparation of businesses, of workspaces, workplaces, were there any lessons learned from the experiences of a lot of frontline, whether those are frontline medical professionals or frontline first responders, or even frontline essential workers in sanitation or in mass transit or grocery store workers? Any lessons learned that can be applied to workspace reopenings as workers are returning?
Well, I would start with, I think the big lesson learned was that we didn't have a process in place to identify what the new essential was or what that meant and how we protected them. And so I think we need to start there and figure out where that break in the system was and how we fix it for the next pandemic. Moving forward, I don't know that I have a great answer for protecting them in the future, but I think we just implore our employers to listen to their employees and make sure that they feel comfortable and that they're monitoring their health, and that but realizing that that isn't always an option for these essential workers.
David, jump in here as far as we're talking about practical protections, and typically when we think about that, we're thinking about PPEs, thinking about masks and gloves, but then let's talk about that financial component, and Dara touched on that a little bit earlier, and what that needs to start looking like as far as not just in terms of, who's returning and the types of protections they get in the workspace in terms of hand sanitizer, but also what do labor protections look like? Because we've seen, we've had a big conversation about that, and we did have a previous micro summit where we talked about just the worry about the potential breakdown in worker rights and labor rights, and how that also, how that issue also impacts folks' financial bottom line as well. So speak to that.
Yeah, it is concerning, and we've seen a lot of instances, unfortunately, of that, where workers are not only having to be concerned about their physical safety in the pandemic, but also from their employers being very concerned about, the protections and labor protections in the workplace. And I think, as Dara was saying earlier, I think we need, especially from an equity perspective, we need to make sure that workers have everything they do to make the right choices for themselves. Because if they make the right choices for themselves when it comes to work and their health, it's going to benefit everyone, obviously, when we're in a pandemic. You don't want someone taking risks because they're afraid of not being able to feed their family or pay their rent or pay their bills, or to do something in the workplace where they're feeling pressure from their employer. And I think, this is pointing out things that we should have had in place before the pandemic that would have made this a lot less worse and created a lot more security for most workers. But I think it's definitely not too late to do things like, make sure that workers have enough sick days, have paid leave. There've been some federal boost to that, but it's not enough. And I think states can do more to make sure that it's boosted, and the federal government should extend it. There also have to be protections. We need to make sure people have strong benefit access to SNAP and other programs, food support, unemployment if they can't work. We need to make sure there's strong consumer protections too, because I think workers, a lot of times, if they're not getting the hours they need in the workplace, they might turn to really high cost small dollar lenders, or debt collectors might come after them. There's been some limits on debts too around federally backed mortgages and rent and foreclosure and eviction moratoriums, where workers who can't have to make that trade-off. We can help secure our workers by extending those protections, and the local and state level plays a big role in that as well, and need to back that up to make sure. And then, as you said, on the labor side, I think, there needs to be, unfortunately, there isn't, it depends on the state and the locality, but there isn't as much enforcement of those types of labor laws to make sure that workers aren't being exploited, that they have access to protections, that their employers aren't messing with them at a time when, everyone's desperate to have a job, and, they're having to make these trade-offs between their safety and kind of, and being able to have an income and support their families.
Hey, Senator, do policymakers, or are you right now exploring expanded powers for certain regulatory and policymaking stakeholders? Folks like, we were talking about licensing and inspection folks, for example, or maybe even prosecutors. Do we need to look at expanded roles for prosecutors? What roles would prosecutors, like say a local prosecutor play or a state AG play in ensuring that a workplace is safe, for example, or ensuring that an employer is not abusing certain types of employees in a time like this. What's that conversation like?
Yeah, I think David is making a lot of the right points. And I think that it is actually state by state. And I think in the state of New York, we feel like we have enough protections in place. We do a fairly good job at regulating that stuff and inspecting it. That's going to be one of the things that we're going to continue to lean on municipalities to do, is do those inspections and make sure labor laws are being followed, as well as in laborers themselves, right? Like, you know, there are numbers that people can call. There's people they can contact to report you know, malfeasance in workplaces. And so we're going to continue to I think lean on what we have. I'm not clear at this point that a much more expanded you know, system of oversight is really necessary, to be honest with you. And to be really honest, people at in this very moment are more concerned about getting people back into the workforce and getting incomes back up and getting revenue moving around the state, and hoping that, you know, that these issues will become less of a problem. But I agree that they potentially could be major issues as we go forward.
We're going to be taking questions from the audience. Thank you, Senator. Questions from the audience in the Zoom group chat. You can leave your questions in the Zoom group chat. I see one question there already. So feel free to, if you would like to start asking questions, if you're a part of the audience, you're watching this micro summit that we're having right now. It's very useful, instructive, educational micro summit that we're having right now. Please do that in the Zoom group chat. We've got Ryan Mast, who is asking if there are any suggestions on how to bridge the equity gap with regards to work policies as things reopen. We were just kind of addressing some of that just now. For example, Ryan says something as simple as a quarantine period following travel will play out very differently for someone who can work remotely versus a blue-collar worker who must report to a work site. Feel free, anyone can jump in on that question. Let's go ahead. Let's go back to you, Dr. Menson.
Well, this is something I've actually had to encounter in terms of occupational medicine practice. So the answer to the question is yes, it's inherently unfair. I think what would help substantially would be access to testing. If you get situations in which the other thing I'll just say is that as the technology catches up and we have some awareness of what antibodies really mean. There was actually a webinar by the American College of Occupational Environmental Medicine last week, in which they specifically talked about serology and return to work. Unfortunately, we're not there yet. So I would say if I was trying to put some emphasis to try to level the playing field among varieties of populations in terms of workers, and having data points that can give us confidence that A, we're not putting them at risk, but also that they are safe to work among other employees, then I would say that really we need to be emphasizing and looking specifically at that. I think that there's some data off of the convalescent serum therapies that are there that might actually lend itself toward that. So perhaps emphasizing some of that in terms of the research might be useful, and that's not something that should take a terribly long period of time. Other than that, I think, again, we go back to a situation in which you're going to have some protection for people in terms of their salary.
I think, Matthew, we lost you for a quick second there. Got a little bit of a signal glitch, but Dara, if you can jump in on that. Dara?
Yeah, sorry, I was on mute. I mean, Matthew's the expert on those issues, but I would say, you know, totally agree. There's differential exposure and differential ability for people to stay home depending on, you know, on what they do. We know that communities, that people of color are disproportionately represented in home health care, for example, and that's a very at-risk population that they're helping with, and working in nursing homes. And we know that we have not done nearly enough to protect both residents and workers in nursing and long-term care facilities. So just ensuring employers are are not pressuring people to come to work while sick is a huge issue.
Yeah.
Ensuring personal protective equipment is available, which is a challenge, but one that we need to really take seriously. And again, I'll raise.
And that was an issue even before pandemic. Your people feeling
yeah,
like
I'm not an expert on the occupational.
Right, you'd be sick. Exactly, you'd be sick, but you still have to go to work. Right.
Yeah.
Exactly.
So even, you know, it's not just a matter of having a leave policy, but will your employees be able to use that leave? Will they be encouraged to stay home when sick, or is there a pressure to come to work when sick or when exposed? So we need to take a hard look at that, and that's why we think a federal standard is needed for paid sick time and for paid leave, and so that it's a level playing field for businesses.
Mm-hmm. Also, we have a question from Debbie Ann Page, who is Senior Policy Director at the Council of State Governments Eastern Regional Conference, and actually Council on Communities of Color. That's her brainchild, in fact. And she has a real good comment here and poses a question. As low-wage, non-essential workers begin to return to work, the cost of personal protections can become quite expensive without a defined idea of future needs. One, who will be responsible to bear the cost of these protections? And two, is there a way to put public policy in place to protect low-wage, non-essential workers? Brooks, David, I'd love for you to jump in on that. Maybe, I don't know, David, if you want to speak to that, and then I'll have Brooks come in.
Sure. Yeah, this is an interesting area, because I think as many people know, especially early on, even still now, a lot of workplaces have struggled to be able to gain access to this. I mean, obviously hospitals have even struggled to gain access to PPE, but it's true, workers should not have to bear the cost of kind of getting their own PPE and kind of bringing that to work. It's something that ideally you'd want employers to be able to either get it themselves or to subsidize it for workers, to kind of put that unfair burden on workers. I haven't heard a ton on this. I mean, one thing that we've heard discussions about potentially, which may or may not be relevant to low-income workers, is like a tax credit of some type for workers, just like how we have a tax deduction for teachers around supplies and things that they might bring in the classroom, the workers who have to spend money out of pocket. But obviously, if you're a low wage worker, it's not going to really benefit you to wait till next April or whatever when you're filing your taxes and having to write that off, and your income is probably too low to be able to take advantage of it anyway. A lot of those deductions and credits, mainly, except with the exception of some important ones like the earned income tax credit, don't really apply to working people. They mainly apply to people who are quite well off. So I think there need to be other measures in place. And this is an area, again, where I think the state and local level, and the federal level too, but a lot of the state and local level can step up on.
Mm-hmm. Yeah, Brooks?
Yeah, I'm not familiar that the chamber has taken a policy stance on federal policy mandate on this, but we are definitely encouraging employers to provide it for employees, and have seen examples of a number of companies even providing it for PPE for customers as well. So I would agree with David's comments on that, and that if the employer is able to bear those costs, I think they definitely should for those employees. Yeah,
Senator, what about that public policy aspect of it, about, protecting low-wage, non-essential workers, what that might look like?
Yeah, I think that it's going to be important that we do that. I mean, again, to be honest with you, I think at the state level, most of us are really, really concerned with some of the macro issues, that some of the implementation things haven't kind of bubbled to the surface quite yet. So I'm actually listening and taking notes as we're talking, because I think some of these issues haven't been really raised, but I think that they're important issues, and I think they're things that we're going to have to specifically pay attention to.
Mm-hmm. Mm-hmm. Matthew, I just saw that we finally got you back, so welcome back. And there was a conversation, there was a question regarding the cost of personal protective gear in a workspace. That's going to get quite expensive, and so would love for you to weigh in on whether or not employers should be responsible for that cost, and also talking about public policy to protect low-wage, non-essential workers. But start on that PPE discussion and about who should bear the cost of that.
Yeah, first I'll apologize for dropping out. unless you
Still,
did that.
still got a little bit of a delay there. Yeah.
I'll just, we're having lightning. If I drop out again, I'm not in a position to call out who pays for the PPE. It seems to me that this is one of those things that needs to be considered almost like every other type of disaster cost, which is if you've got PPE in a hurricane situation, or if you've got PPE in a chemical situation, generally speaking, the mechanisms are already there, and they do exist in terms of disaster replacement funds. And so I'd say that needs to be looked at in terms of how an employer or whatever mechanism a state or local jurisdiction wants to execute in terms of getting the PPE there. The question of the PPE is it's got to be there. It's unconscionable to put people in a situation which they don't have those protections. So the mechanism on how you pay for it certainly does need to be addressed. We're gonna have to do that, but on the fly. But I think the templates for that compensation already exists. And I think that might need to be exploited or looked at a little more fully, especially when we talk about non-traditional applications of PPE. And I say that coming from a position as one of the technical advisors at NFPA on this type of issue. So I don't think this is insurmountable. I think it's something that we can look at pretty quickly. It'll have some nuance that'll vary at local jurisdictions and in states because their mechanisms for requesting disaster aid are different. But I think it's something that needs to be understood really kind of in that context. And I forget what the second part of the question was.
You know, about the low-wage non-essential workers and what the public policy might look like to protect those low-wage non-essential workers. You got a lot of low-wage workers out there. A lot of low-wage workers have actually suffered economically as a result of the pandemic.
Yeah, I think with regard to PPE, the issue is the same. I mean, just because they don't make as much money doesn't mean they don't deserve the same protections. So I think it's critical is one of the things we looked at was the original application of some of the emergency funding that was supposed to go to help try to retain employees and protect wages was ultimately applied for by large corporations. Many of them in good conscience return the money, but I'm concerned going forward that what we don't do is make sure that we understand that needs to go specifically to the population we're talking about. And when you're talking about small or micro businesses, those individuals are going to have probably greater risk because they don't have the resources to dip into for the short bridge to getting PPE and other mechanisms in place to protect their employees. Yeah. That is critical. And in fact, that's where we're going to see the greatest number of, if you will, economic casualties in this thing. I think we already are.
Yeah, yeah. You know, one question I haven't seen brought up enough is that the challenge of mental and emotional health needs. And you know, obviously we all need it. You know, going through a time like this, you know, families, households need it, especially the kids need it with school closures. And then you think about also as people are returning, going back to workspaces, and then the anxiety, the nervousness of dealing with the potential of getting infected by anything from an infected table or space to an infected coworker. And so how are we meeting out, and anyone can jump in on this, how can we meet those growing mental and emotional health needs? And that's also a cost and an expense. And it's something I think that people take for granted, they're not thinking about. But that is going to have to be an investment as we get back to reopening. And so many people have been traumatized by pandemic, are still being traumatized by it as we speak.
Charles, this has been one of those issues that frankly was part of a conversation even prior to, you know, BC, right? Before COVID, right? And so I think that some of the work that we started out with in terms of insurance and making sure that mental health is covered under insurance the way physical health is covered is going to be an important step. And we've taken some strides along that lines in the state of New York. I'll tell you that I was very happy that one of the first things that the governor did is create an emotional support line around COVID-19 here in the state of New York. It had been on the city level, the issues around mental health have been one of the major initiatives of Mayor de Blasio, and particularly headed by his wife, Charlene, who ran the Thrive NYC program. And so I think I think all of those techniques are going to be necessary both around making access affordable and available, but then also some significant work, Charles, around about eliminating the stigma. Again, particularly in African American and Latinx communities, is going to be really, really important, because the notion of going to see a therapist or seeing to your mental health is not a usual thing. It's not part of the cultural construct that you find in a lot of these communities. And so a lot of that work, and generally, I mean, I just think in generally we're always kind of breaking down the stigma around mental health issues, period, regardless of what the mental health issues are, making people just kind of more comfortable with seeking that help. But on the state end, part of what we need to do is figure out how to make it affordable and available.
We also have some real useful material that's being provided in the Zoom group chat. Thanks to Marcus Coleman, also part of the Healthcare Ready team, also made available a useful guide or a policy brief. Darren, you can speak to this a little bit from at TFAH.org. That's Trust for America's Health. You all put together a public health emergency policy brief. Also, Marcus listing the CDC guidance on mental health as well as Mental Health America COVID-19 resources as well. Appreciate that. And I am real curious, speaking to your policy brief, Dara, from a bit earlier on, and other folks can jump in on this, what that relationship is going to look like between the public health emergency space, or the level of coordination between the public health and public health emergency space, and also institutions and organizations and workspaces. We're going to enter into a new normal, right, as we're reopening and as we're returning. What's that level of coordination look like? I go back to years ago when I was helping with the response to the anthrax attack on DC, and there was this it started off very confusing and very hectic and chaotic, but there was a level of coordination and a rhythm we needed to find between first responders like firefighters and EMTs, and also those buildings or those property managers when they would find white dust. And people would be worried, okay, is that anthrax or not? So I'm wondering what that's going to look like in a reopening or a reopened kind of world.
Well, I think it'll vary pretty widely from community to community. We have thousands of different local health departments and 50 plus DC in our territories, different state health departments. In some cases, we're seeing no daylight between governors and mayors and their public health leadership. And in some cases, we're seeing people losing their jobs in the public health departments because they have been strong voices for public health. And we need to make sure that businesses and policymakers, state and local policymakers, feel comfortable following public health guidance. That for all of what I'm seeing is that public health guidance coming out of state and local health departments comports with what CDC has been providing. CDC is communicating really well with state and local public health on what guidance looks like in a rapidly changing and, as Matthew said, not totally understood virus. So there is a lot of guidance on the CDC website for various types of businesses. I want to make sure people know that there was a lot of news attention about the limited amount of guidance that CDC was allowed to put out. Mm-hmm. The week after that, though, they put out a lot of different kinds of guidances with information for different types of workplaces and camps and schools and daycares. So I hope I'll put the link up after I talk, but I want to make sure that people know that guidance is out there, and it's not about just keeping everything shut, but it's about safely reopening as well.
Brooks, thanks so much for that. Brooks put in a link to how to reach a crisis counselor, crisistextline.org. Very useful. Brooks, did you want to jump in on that?
Sure, I'll just say it's a free service that a number of companies have been supporting, and they've been active in. The senator mentioned the mayor's and the governor's initiatives. The Crisis Text Line has been a big partner in that. And Harry's, the shaving company, has been a big partner of the crisis text line, especially promoting it to men and men of color to help with the stigmatism that you addressed earlier. So just wanted to provide that as a free service, but one that has been provided through a lot of corporate partnerships.
You know, last question here too, and if there is anyone in the audience, we have several minutes left. If you have questions for our panelists, you can do so. You can leave those in the Zoom group chat, and I'll relay those shortly. So we still have a little bit of time left. But what's, you know, something we also overlook or we take for granted is just communication. What are the conversations going to look like or should look like between you know, the policymakers and their constituents, the employers and their employees? Like, what's that whole, you know, pandemic world, public health emergency communication framework or ecosystem? What does that all look like now? What should that look like? How should we be communicating with each other, or how should organizations be communicating with various constituents and stakeholders in a time like this, as we're returning to work, as we're returning to public spaces, as we're now venturing outside of our households? I can throw that out there to anyone. Anyone want to jump in on that? David?
Yeah, we've been struggling a lot with that at Prosperity Now, especially thinking about, you know, the advocacy work we do with local, state, and federal policymakers. You know, we connect folks from our network, thousands of nonprofits and local organizations across the country. You know, our groups, usually they do in-person visits and district visits. I'm sure the senator's familiar with this and, you know, gets visits all the time from his constituents. But, you know, now that that's off the table, making sure that that communication mechanism is there, you know, we're trying to come up with new ways to work creatively with different policymakers to make sure that that continues and the voice of folks in the community are actually still connected to policymakers. I think a lot of that happens at the state and the local level already, and, you know, it's taking a new form, but the federal form is really hard. And I also think at the organizational level, it's really difficult. I mean, employers too, I think, both with, you know, their customers and also, you know, with their employees, especially that level of communication, if you're not in person, and even if you are in person, you're not gathering the staff all together to have a big discussion about it. I think we need to be thoughtful about what we communicate, how we communicate, and err on the side of over communicating and making sure information is out there, especially with comfort levels for people who do have actually the option of returning to work, or if it's going to be staggered in some form. You know, how do you make that a comfortable workplace? How do you make sure it's equitable and fair for everybody and safe? You know, I think those are things where you want to make sure, more important than ever, to hear feedback from everyone and make sure everyone understands, because the stakes are so high right now.
Yeah, Matthew, be real great to kind of hear your perspective on this as far as like what that level of communication looks like, because we're in this sort of very bizarre kind of reality now where, you know, tensions are high, you know, now. So COVID-19 is going to be here to stay for a while. And so, you know, as people are navigating through public spaces, through workspaces, you know, that heightened anxiety over like who's infected, who's not. Are you wearing your face mask? Why is your face mask like just, you know, kind of halfway on? Or, you know, why are you running through the park without one, right? So what's that communication scheme look like to you?
Well, I think you have to use trusted venues. I saw the data that came from MIT related to misinformation on social media and how much of that was actually bot related. And so that lends itself to some disinformation that's often very destructive. Just really quickly, though, I want to touch on something that Senator Parker talked about with regard to mental health. There's data, National Library of Medicine shows really good utility data with individuals that otherwise wouldn't go to a clinician or a psychologist proper by using telemed. And so telemedicine has anonymity built in. This is a perfect venue for it. There's a privacy element, and I think that that's quite protective of folks that might otherwise have secondary fallout by trying to seek, you know, counseling. And it's critical at this point. So getting back to your question, I think you have to go through the mechanisms that normally are trusted within a community in order to be effective with the communication. I think the information needs to be as factually based as possible. I think you need to be very candid when you don't know something. And I think I'd be aware of timelines, because timelines, it's like the discussion about modeling where all models are wrong, but some are useful. I think all timelines tend to put you at risk because there are a variety of things that go on with the virus that we don't know about. So I think it's important to make sure that we kind of adhere to those communication points and make sure that the message is direct, truncated as much as possible, and repeatable. I think that that's incredibly important too.
All right, Dr. Minson, I'm going to give you the last word on this. We reached a little bit over the 11. We try to stay punctual and keep these micro summits tight because we, especially there on a Friday, want to make sure people are able to get on with their weekends. I really do appreciate everyone's time here for our micro summit, our healthcare ready CSG, Council of State Governments, Eastern Regional Conference, Council on Communities of Color Micro Summit, Advancing Practical Protections, the Pandemic Return Policy. What's that all look like? We are indeed going to continue this discussion. First, this micro summit right here will be made available as a video on a variety of digital and also social media platforms. It will be included at the micro summit, the COVID-19 micro summit resource page at the Council of State Governments Eastern Regional Conference website, csg-erc.org. For more there. I want to thank our panelist, State Senator Kevin Parker, representing 21st Senatorial District in the state of New York. Go to nysenate.gov or at Senator Parker on social media. He is also the chair. He has made the Council on Communities of Color possible, as that is a division of the Council of State Governments Eastern Regional Conference. They continue to do good work. And thank you, Senator Parker, for helping us make these micro summits possible. Also joining us, Dara Lieberman, who is Director of Government Relations for Trust for America's Health. Dr. Matthew Minson, I'm glad we got you back. Senior Advisor for Health Affairs at the Texas A&M University Health Science Center, also a former state, local, federal health official himself. Brooks Nelson, Senior Director at the U.S. Chamber of Commerce Foundation, joining us as well. And David Newville, Prosperity Now's Vice President of Policy and Research. It's been great talking with you all. I'm sure at some point I will touch base with you. Maybe we'll see each other on the other side of the apocalypse. But thank you for your time this morning. I am Charles Ellison, moderator for this micro summit discussion, also host of daily public affairs show Reality Check on WURD Radio, which is based in Philadelphia, 96.1 FM, 900 AM, and also wordradio.com for the live stream, for the national live stream. So definitely continue to go to csg-erc.org for more of these micro summit discussions. Healthcareready.org, you definitely want to go there. They also powering and making this micro summit possible, healthcareready.org, for great information, also guidelines and resources and tips on how to get through pandemic. So want to appreciate the Healthcare Ready team, Kanaya Hardy, Marcus Coleman, and the Executive Director, Dr. Nicolette Lewis-Saint. Thank you for getting us to this point today. That ends our discussion, and do find that discussion at the CSG ERE website, and we'll see you during the next micro summit. Take care, have a great weekend.